Durango TV News brings you Healthy Living in the Four Corners, featuring experts on wellness, nutrition, and lifestyle to keep you healthy and fit to enjoy all the region has to offer. Brought to you by San Juan Regional Medical Center in Farmington. Thanks for watching this edition of Healthy Living in the Four Corners. I'm Deborah Uroda. It's an embarrassing problem that we often are reluctant to talk about. Urinary problems, including incontinence or inability to pass urine, are more common than you may think. In fact, the Urology Care Foundation estimates that more than 33 million Americans suffer from incontinence.
Things like needing to go to the bathroom frequently, inability to empty the bladder, starting and stopping, difficulty starting urination, getting up 2 or more times at night to urinate.
We visited with the urologists at San Juan Health Partners about the common causes of urinary tract problems and how they can be treated. For men, an enlarged prostate is one of the primary culprits of urinary tract dysfunction.
We can treat you typically medically with medications that can be very effective in relieving those symptoms for most people.
In women, incontinence becomes increasingly common as they age, but there are treatments that can be as easy as changing your diet or losing weight.
We're not entirely sure exactly why these tend to help, but we've seen through multiple studies where women have lost tremendous amounts of weight. They'll notice up to a 50% reduction in their urinary symptoms. Caffeine is a big culprit, and it's interesting how you can, drink coffee for years and years and years and be totally fine with it, but then it just seems, kind of subtle, but it, or a gradual process, but that caffeine can be contributing to your overactive bladder. There are some other foods that for some individuals can be offenders, and I will often have them do a food diary and have them try to associate any of the things they eat or drink with their worsening symptoms. Alcohol is another big one.
Kidney stones are a painful problem that can affect both men and women. Treatment can range from medications to deal with the pain to removing the stones with a ureteroscope.
So kidney stones are exactly that, they're stones. Essentially calcium and other electrolytes that are in the urine can precipitate out or kind of form stones within the kidneys. Most people don't know that they have a kidney stone until it starts to try and pass down towards the bladder, because that's when it starts to block up the flow of urine. Everything kind of stretches like a water balloon, and that stretch is what causes that severe pain that people talk about. Oftentimes the more common treatment option these days is called ureteroscopy. It's simply using a camera, a specialized small camera, under an anesthetic, no incisions. We go in, minimally invasive. We can get to where the stone is, use a little laser fiber, break the stone up into small pieces, and we can actually use a little basket, pull out the fragments so you don't have to pass the fragments on your own. So what I typically tell patients is, if you're able to go to work, if you're able to get through the day, if you're not taking narcotics, if you're able to drive, that kind of thing, then maybe it's best to give it, days or weeks, usually not more than a month, and see if it'll pass on its own, because obviously it's better to not need a surgery.
If you'd like to know more about incontinence or other urological issues, visit the San Juan Regional Medical Center website at sanjuanregional.com. I'm Deborah Uroda for Healthy Living in the Four Corners. This edition of Healthy Living in the Four Corners has been brought to you by San Juan Regional Medical Center in Farmington.